Hello and welcome to R&R's Ask the Expert. I'm your host, Valerie King, R&R's editor-in-chief, and I'm joined today by Marlene Linders, Executive Director of the Linders Health Institute and President and CEO of Philders Group International. Marlene has an impressive mix of expertise as she holds bachelor's degrees in architecture and nursing science, which isn't very common, as well as a master's degree in science, and she focuses on where these disciplines intersect. For more background, the Linders Health Institute addresses safety, compliance, and exposure risks during construction of healthcare buildings and built environments. The Institute's Infection Control Risk Assessment course overviews the impact construction has regarding infection control, emerging infectious diseases in the built environment, including air and waterborne pathogens and MRSA, as well as exposure of risks during construction of healthcare facilities. The program has obtained global recognition and is now used as the U.S. Green Building Council's course for healthcare and by the American Institute of Architects for continuing education. Builders Group International is a consulting firm that provides strategic positioning to companies that want to gain access to or increase their footprint in the healthcare market. It provides education and corporate risk management programs for infection prevention to the AEC, contractor, real estate management, educational, and healthcare industries. The firm acts as a medical resource and provider for ongoing education and compliance programs designed to help clients function at a lower liability and risk, which we know is so key here in the restoration industry and construction overall. So, without further ado, I'm so thrilled to have Marlene here today to share insights on infectious disease and cross contamination control for restoration contractors. And that's from how to gain more business in this space to tips on actually doing the work of disinfection and decontamination. So we have a great interview ahead of us, especially in this time of a pandemic. So, and not to mention mitigating exposure risks. I almost forgot. All right. Thank you so much for joining me, Marlene.
Thank you, Valerie, for asking me to come on board today. And I also wanted to congratulate you on your new position.
Thank you so much. That's so nice of you. And I'm so thrilled to have you. This is such an important topic, and you have such a good perspective from the consulting communications and working with medical industry clients to, again, like I said, doing the actual work that ties to infectious disease control. So, tons to talk about. All right, so I gave some background, but can you start by sharing how your expertise relates to construction and more specifically, of course, property restoration and remediation contractors?
Well, my background in academia is in healthcare and life sciences, healthcare science, as well as in architecture. And while working in the design role, I oversaw many projects for construction and making sure that construction managers were doing their jobs correctly. And then I also oversaw projects in commercial areas to making sure that all the I's were dotted and T's were crossed. And when I started working in healthcare as a registered nurse, the two seemed to fit together. They were married, and we started learning about cross contamination and the risks it posed not only to the patient population, but also to the healthcare workers, as well as the worker bees that were in the construction, restoration, remediation industry. So that's how that all got started.
Awesome. Again, that's just such an intriguing connection of different disciplines and perspectives. So, to break this down further, looking at what you do today and how you serve construction clients, restoration clients, what would you say are the most common reasons restoration companies reach out to you for help, and what kinds of solutions do you offer to address their needs?
Typically, well, I shouldn't say typically because there are no typical projects that restoration and disaster and recovery managers, companies work at. They're all different and everything's customized. But when they're working in a specialized environment, such as a healthcare environment, they're very concerned about exposure risks in high risk quadrants within the hospital setting itself. And there's 34 high risk quadrants that are in each hospital, and each quadrant has specific pathogens that it hosts, if you will. And restoration contractors need to understand what disinfectants, what PPEs, what type of containment and barriers need to be implemented to make sure that safety and compliance regulations are met, not only in healthcare, but also because some of these pathogens have now cross-threaded themselves into the commercial environment. The general population and communities are also at risk. So they call us about specific training, education, and how can they learn about this? And we teach them all those specifics.
Very helpful background. Okay, so given you focus largely on healthcare facilities and, like you said, large commercial spaces, I mean, I think about that. I think built environments with some of the most stringent rules around infectious disease and cross contamination control. One could argue that we're looking at the gold standards of infectious disease control. So, to help define that quote unquote gold standard, could you perhaps offer highlights or examples of the unique precautions, procedures, etc., that healthcare and commercial facilities expect from construction and restoration contractors, just to give our listeners an idea?
Sure. Typically, when restoration or remediation contractors come in and do a presentation, healthcare facilities like to know that the presenter or the contractor is very sensitive to their needs. And hospitals and healthcare is not really very good at explaining exactly their pain points. So that's why the burden falls on the contractor to really understand what the pain issues are. So to do a presentation and to speak about not only the fact that they've been in business maybe for 30 years, but here's what they do to meet the compliance requirements so that the facilities don't get tagged during an audit. And letting the healthcare facilities know that they have specialized training in the area of specifically three key areas: ICRA, infection control risk assessment. The next one would be PICRA, pre-construction risk assessment, which deals primarily for the facilities itself. And then also the ILSM, or interim life safety measures, knowing exactly what to do, how to contain areas, what happens if there's a utility outage, what precautions do they take, and how are they meeting the very stringent guidelines that hospitals are up against during these type of projects.
Super helpful. Okay, so now I want to talk about a training program you offer called The Fundamentals of Infection Control in the Environment of Care for Healthcare Contractors. I guess I'd just love to glean insights from that, that restoration contractors could apply across residential and commercial spaces, not just limited to healthcare clients. So, first question under that umbrella: what are a few top infectious disease exposure risks that come to mind with regard to contractor safety? And what are some ideas for how they can mitigate those exposure risks?
Well, not only in healthcare, but also in commercial projects as well, and in residential, but primarily commercial. Working above ceilings is one of the most dangerous areas that contractors are at risk for when they're on projects. So special precautions are always needing to be implemented. And specifically, the reason that there are problems above ceilings is because we have ventilation systems that they're working in, or we have open spaces, if you will. And if these spaces are not attended to by the commercial building owners or healthcare facilities, they could be infested with dead rodents or uh, basically dead rodents. Dead rodents carry carry bodily diseases, and they carry spores that are dormant. And if something happens, that they should be moved, or if they should be hit by a foot during walking time when contractors are up there assessing the area, then spores can get released. And if they're not properly equipped with PPE, they can be inhaling certain type of viruses, such as a hantavirus. And recently we've had a pretty severe workman's comp case where two people were exposed to that. One is permanently disabled, and the other one had spent over a year recovering from exposure to hantavirus. And that was in a hotel setting.
Now, of course, I have to ask the people at the end of this work about the customers. I guess what are a few top infectious disease exposure risks to the customers of these contractors, the building owners and policyholders they serve, and how can they mitigate those risks?
Well, that's a very good question, because recently we had an email and a phone call with a large real estate firm out of the state of California, very concerned because they are congregating with real estate agents in older buildings, and they're very concerned about cross-contamination from older designs of air conditioning systems, or HVAC. And could they all be at risk for that? And there's something called the spread index. So however, the spread index of how the air exchanges are maintained during the HVAC system, and what the design is and what the occupancy load is for that room, determines the exposure risks for the occupants. And these buildings they're not new anymore in regards to a design for prevention for exposure to something like COVID. So building owners can be exposed to that. Also, there's something in plumbing. Most contractors are very concerned about Legionella. Legionella is a waterborne pathogen, but Legionella is very easily remediated, and it can be reconciled in a few basic steps. But one of the other major waterborne pathogens is Pseudomonas Erogenosa. This is a superbug, and we don't have antibiotics that address this, and it is a waterborne pathogen, and exposure risks are very high and they're increasing, as well as TB is on the rise. So people need to start taking precautions against this. WHO has just recently sent us a briefing on the fact that they're very concerned that mycobacterium is on the rise, and that people, when they're going into public spaces, not only with COVID and the different variants, they also need to be concerned about TB exposure risks. So there you have it.
All right, so switching gears a little bit, I understand, and I think this is super cool that there's an opportunity gap you are seeing for restoration and remediation professionals, that they need help speaking the language, so to speak, of healthcare and in certain commercial markets. So, could you start with the healthcare industry? What new and notable opportunities exist here for the restoration industry?
Sure. Um, the landscape couldn't be better for the restoration industry, because in 2012, unfortunately, Hurricane Sandy pummeled New York City. And the federal regulatory agencies found out, because what had happened with Hospital Langone Medical Center, having to move all the patients out, and the difficulties and exposure risks, the auditing agencies put together a very stringent EMP program, which stands for Emergency Management Program. And all hospitals and healthcare facilities are required and mandated to put together a very strict policy on what happens during a disaster, and what are the teams that they're going to be putting together to help make sure that they meet compliance. And restoration and remediation contractors have one of the best and most comprehensive knowledge and database about biology, microbiology, containment, PPE, and exposure risks. They already have that, and how to disinfect and how to mitigate that. Well, hospitals are supposed to be reaching out to the private sector to literally put contracts into place with them so that during drills as well as the actual experience, that they know that they are taken care of, and they can show during these audits by the federal agencies that here is a possible scenario that could happen, but these are all the steps in place that we have, and all these steps will protect, number one, will protect our physical assets, will keep our business operations open, and will protect the patient population. These are three critical mandates that the auditing agencies are requiring for healthcare. And the recovery, the property restoration and recovery industry meet all those requirements.
So, okay, broadening to opportunities in other commercial areas beyond healthcare, like office spaces, malls, hotels, you name it. What opportunities exist there for restoration contractors?
Well, I can tell you right now, malls are one of the biggest one. With and an example that we had a few years ago is when we had a very high-end shopping mall in a northern state during the height of holiday shopping. The one of the premier shopping stores was closed down. It was a clothing store. It was closed down because one of the workers was found to have a very high colony count of MRSA, or methicillin resistant Staph aureus. Well, by law, the manager of this store, it was a large chain store, had to report that to the public health department. Well, the entire mall was shut down during the Christmas holiday, and this particular mall was on the company was on the New York Stock Exchange, which impacted the shareholders. So the store owner had called us because the mall developer and manager had called us because they had no idea how to handle this. They just didn't know they just didn't even know where to begin. And they had no restoration contractors that they could call, that they knew to call. They didn't even know who to call about something like that. They didn't know how to disinfect. They originally started by having their maintenance people go in and clean the bathrooms because they thought that the store employees had gotten this MRSA from the bathrooms. And it was quite a fiasco, but we had to prepare a list for them, and specially trained contractors, about here's what needs to happen, here's how the flow needs to be, even with future inventory coming into the mall. There had to be a policy and procedure about how the goods were exchanged to reduce risk and manage liability during transportation. Huge opportunity.
Wow. Yes. And thanks for that case study. Really helps give color and bring to life what you're getting at here. So, given this huge opportunity, these really significant needs from the healthcare space, from the commercial space, and these valuable input skills, knowledge that the restoration and remediation industry can give, how do we account for this gap and address it? Like, what can restoration contractors do, in your opinion, or do better to seize on these opportunities?
Well, there's a couple of things that they can do. Number one, with all of our clients, we start out by telling them that, first of all, let's take the example of healthcare. When you're going to your provider and you have some type of an illness that requires a specialist, let's say you have a lung infection, so you're referred to a pulmonologist. These are called specialty physicians or specialists. So, because they have a very specific knowledge about a certain part of your body, your lungs. Well, we tell our clients, stop looking at yourself as a contractor. You are a specialty contractor. You have a very specific and comprehensive knowledge plus experience in dealing with cross-contamination, disinfection, and biology and microbiology, and you understand the systems and the design and how each of these systems in the design can cross-contaminate, and you can forensically trace back where the source started and how to mitigate that. That's a very special expertise. They don't market themselves like that. That's number one. Once they understand that, we help them with a very specific branding. They need to brand themselves better. When they brand themselves better, they're positioned better, and they're looked at as more than just a company that comes in and cleans up water or floods or something like that. They have very specific knowledge and they know what to do. So that would be my advice to them, to kind of really zero down and look at the areas, look at the verticals that you're in, decide what verticals that you really want to be skilled at, and then start putting a campaign together for that and have a branding that is second to none, and you will get much more business, and you create we call TOMA, top of mind awareness.
You already offered some amazing case studies. Just want to make sure, is there any other notable case study that sticks out or one in particular that's more, of a success story? I guess they all have been. But yeah.
Um, I think one of the ones that recently came up, it was about 9 months ago. We had just held a workshop in Orlando, and we had a large construction company that had come in. And by the way, I should also mention that when we teach general contractors that build the buildings, we always tell them that you must have a service agreement with a disaster remediation or restoration contractor that is trained in infection control as a part of as having a service agreement, because if something goes wrong, they can mobilize, and they can mobilize to meet compliance, because the number one problem in during disasters for construction are floods with sewage, and general contractors do not know how to contain that. So anyway, during this workshop, we were training them, and about 2 months later, one of the superintendents that had attended that workshop called and specifically asked a question about a laboratory that they were renovating, and they were concerned because the laboratory was a older building. It was 40 years old. It had been closed for 40 years. And when it was owned by the hospital, it was sold to a private developer, and the developer was saying they have nothing to worry about because it had been closed for 40 years. And the superintendent wanted to know if they should be concerned for their workers. And I said, what type of laboratory was it for? And when he was explaining to me some of the experiments that they were using, I knew instantly that it was some type of experiments for TB, and TB can stay dormant for many, 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 many years, the spores. And I said, so no, you can't just go in and start renovating. You have to start putting on your own. You have to have a whole risk assessment done prior to that to see where the TB, where the samples were, and what if there's possibilities of colonies in the HVAC system, because your workers, if they're not wearing PPE, can inhale that and end up having Mycobacterium TB. And that's what they did. The building was full of TB. And they told the property developer that, and they had to add to the cost of remediating or redoing that building. So
Wow.
there, and I tell them there are no such things as dumb questions, but actually the only dumb question is the question that is not asked. So ask anything, anytime.
So, keeping with the topic of learning and coverage of takeaways now, before we go about, of course, the COVID pandemic, I couldn't have you on and not ask about it. First off, are there any reflections or predictions on the pandemic's impact on the relationship between property restoration companies and infectious disease control?
Well, we're seeing that, especially in states like Pennsylvania and California, and I don't know why that's occurring, but in order to work on any type of building, contractors have to show some type of education and training. They have to show the property owner that they've had some type of infection control training that is specific to construction. So we offer a 1 hour online. It's an awareness course. OSHA has given its blessing, and they love that. But they also are looking at more comprehensive training for different types of commercial spaces. And as you well know, healthcare is no longer just in hospitals, it's in outpatient settings, it's in malls, it's in hotels, it's in Walmart. They have laboratories in Walmarts, they have laboratories in Targets. It's all about market capture for healthcare. Um, but I would advise property restoration people to have some type of education and training, the basic education and training on infection control. And they need to have it from someone who's worked in a clinical environment, that has not just taken an 8 hour course and has said, hello, now I'm an expert. We've been seeing that as a problem as well. So they have to be very careful with that, because healthcare does look at that. Um, I don't know about the commercial buildings, but commercial property owners want to see some type of safety for infection control. And that's where, again, the property restoration contractors will have top of mind awareness.
Awesome. All right, almost done with the interview. Are there any other tips or, yeah, just advice to contractors who are offering COVID-19 disinfection services or thinking about adding them?
Well, I think that all contractors in this particular industry, in this vertical, should have some type of specific infection control offering to any type of properties that they manage or that they risk or that they oversee for risk. Um, and that's going to be something now, and it's going to continue on into the future. You're going to see this. The COVID-19 is going to continue to mutate. And it's just like the flu. The reason we get the flu vaccine every year is because the DNA of the flu mutates. And so the vaccine from the year prior does not meet the new DNA that the flu has changed into. So they need to be offering something special in relationship to that. And again, to show the property owner or the healthcare owner, these products are approved for this amount of dwell time. This is the kill ratio. This is what we use. And here's where we've used it before.
Awesome. Okay, thank you for that. My last question is just an open-ended one. Is there anything I didn't ask about that you'd like to cover?
You did a really good job, Valerie, for this being brand new. So I can't think of anything additional that we need to cover.
Thank you, Marlene. And speaking of follow-up questions and learning more about this topic you're so skilled and versed in, before we go, where can our listeners go to connect with you or learn more about the Linders Health Institute and Philders Group International?
Well, you can go to our main website, which is Philders Group. Philders is spelled Phil, like Phil, Philders group, phildersgroup.net. And that basically will navigate you through to the Linders Health Institute. There's also on the first page, there is a 3-minute video It's like a course trailer of our online course. It gives you like a movie trailer. It's a course trailer that shows if you want to take our course, you can see what the student learning experience is. It was done very professionally, and it was done in association with one of the largest healthcare systems in the country. It was a partnership there.
Thank you so much.
Yes, and if they have any questions, they can always call 844-438-4272, or they can email us at info@phildersgroup.net.
Love it. Very helpful stuff there. Okay. So thank you again, Marlene. Listeners and viewers, for more insights on restoration, remediation, and the people behind it all, visit our website, randrmagonline.com, Apple or Spotify. If you haven't yet, please be sure to follow the podcast to keep up with our latest episodes. And if you could give us a quick review and rating, we'd be so appreciative. We're also on LinkedIn, Twitter, and Facebook, so connect with us on social too. This has been R&R's Ask the Expert. Thank you as always for listening.